Dear viewers, in this video, we will explore the Namaste Portal, a unique initiative by Ministry of Ayush that connects all the Ayush practitioners, researchers, and the student on one platform. Let's see how it works. I am Dr. Mahesh Hirulal, Associate Professor, STM College of Ayurveda, Hassan. Namaste stands for National Ayush Morbidity and Standardized Terminologies Electronic Portal. It is designed to create a unified, standardized database of Ayush related to health, diseases, and treatment terminologies. Standardization in medical terminologies means creating agreed definitions, norms, units, and rules that form a common language for healthcare. This ensures smooth understanding and exchange of information between doctors, researchers, and institutions. A well-known example is International Classification of Diseases, ICD, developed by World Health Organization. It provides a globally accepted codes for diseases and health conditions. The current version is ICD-11, making the healthcare data consistent and comparable worldwide. In Ayush systems, disease names, diagnostic terms, and treatment records were often documented differently across the regions and institutions. This created the challenge in research, data comparison, and policy making. Without a standardized language, sharing patient records, conducting clinical studies, and integrating Ayush data with modern healthcare system like ICD was very difficult. The Namaste portal was developed to solve this problem by creating a unified, digital, and standardized platform for recording and exchanging Ayush morbidity data across the country and world. On 17th October 2017, the Honorable Prime Minister Sri Narendra Modi ji officially launched National Ayush Morbidity and Standardized Terminologies Portal in Delhi. This marked a historical step towards the integrating Ayush systems with standardized medical terminologies and digital health records, paving the way for the better research, documentation, and global recognition of traditional medicine. This is the homepage of Namaste Portal. From here, users can access various resources related to standard terminologies, morbidity codes, and reporting systems for Ayush system of medicine. Now let's navigate to the standard terms section. This is one of the key features of the portal, providing defined and accepted terminologies for Ayurveda, Siddha, and Unani system. Within the standard terms section, you will find out multiple subsections, each dedicated to a specific category in SAT-A, SAT-B, SAT-C, so on, up to the SAT-J. The standard terms section of the Namaste portal is divided into 10 main categories known as SAT-A to SAT-J. SAT-A covers the basics and fundamental terminologies of Ayurveda. SAT-B focuses on structures and functions of the body. C is dedicated to Vyadhi Vinishchaya and the disease identifications. SAT-D lists standardized signs and symptoms. SAT-E contains Ayurveda morbidity codes for the uniform disease classification. SAT-F deals with pharmacognosy and pharmacology of Ayurveda. SAT-G explains the preparations of the medicines in Ayurveda. SAT-H focuses on preparations of food and beverages. SAT-I contains the terms related to treatment approaches in Ayurveda. And finally, SAT-J covers the preventive and promotive health measures terminologies. Together, these categories create a common language for Ayush healthcare documentation and research. Here in standard terms section, we are now focusing on SATC, Vyadhi Vinishchaya and Nidana. This section lists all the standard terminologies related to disease classification in Ayurveda. In this section, all terms related to Vyadhi Vinishchayas were listed out, like Vyadhi Paryaya, Vyadhi Beda, etc. Next, we move to SAT-D, Signs and Symptoms. This section contains standardized terminologies for various clinical signs and the symptoms documented in Ayurveda. Each term comes with its translation, definition and unique code. One of the most important features of the Namaste Portal is morbidity codes section. This section provides standardized codes for various diseases and conditions in Ayurveda system aligned with ICD-10 and ICD-11 for dual coding. These codes can be easily downloaded in MS Excel format, making them convenient for integration into hospital records, research database, and public health reporting. Now let's see how to navigate and find the morbidity codes for particular diseases. First click on DIS, that is Vikara, in the morbidity codes section. You will see the multiple categories such as Dosha Vaishamyata, Dhatu Vaishamyata, Mala Vaishamyata, Agni Vaishamyata, etc. Vata Vyadhi, Pitta Vikaras, Shleshma Vikaras, Sannipataja Vikaras are listed out. Again, Vata Vyadhi's different avasthas and the disorders were categorized like Dosha Avastha of the Vata, Nanatmaja Vata Vikaras, Samanyaja Vata Vikaras, Ahurta Vata Vikaras, etc. If you go further, for example, for the Nanatmaja Vata Vikaras, all the 80 types of Nanatmaja Vata Vikaras are listed out as AAB from 1 to 80. For example, here specifically if you take the Pakshagata, it is Kevala Vatajanya Pakshagata. On Namaste Portal, it is assigned the morbidity code as AAB 52. The entry also provides its probable English translation along with references from classical Ayurvedic texts. This way, each condition is not only coded for modern documentation but also linked to its original sources, ensuring the authenticity and traceability. The scope of Namaste Portal goes beyond just creating a database. It serves as a national platform for standardizing the Ayush terminologies, coding diseases, and integrating with them with the national and the international health classification systems. Standardized nomenclature of medicines and clinical terms is one of the national digital initiatives. With this, Namaste Portal is associated. It promotes the use of electronic health records within Ayush healthcare organizations and works as a repository for research, policy, and insurance coverage and reimbursement system. Now let's see how to browse the Namaste Portal. From the Google browser, you can put the Namaste Portal and go for CCRAS website where there are different CCRS digital initiatives are there, and find out the Namaste Portal. This is the home page of Namaste Portal, where the morbidity codes standard terms are listed out. See the standard terms and click for Ayurveda, and you can find out the different sections, that is from SAT A, B, then the C is for Vyadhi Vinishchaya, D is for signs and symptoms, E is for the National Ayurveda Morbidity Codes, F is for pharmacognosy and pharmacology, G is for preparation of medicines, then the food and the beverages, the terminologies for the treatment aspect, and the J is for preventive and the healthcare terminologies. Another use of this portal is you can go for directly see the morbidity codes. You can download the codes from the browser, and these are the list of morbidity codes in a table views, and you can also see the tree view format where you can go on finding the different morbidity codes. Another use is you can very easily find out WHO ICD-11 classification. Here you can see all the WHO 11 ICD classifications, like the infectious diseases, neoplasms, the disorders of nervous system, ears, circulatory system, respiratory system, digestive system. All the different systemic illnesses or the diseases were grouped. For example, if you take the respiratory system, click on the respiratory system, then you will get the upper respiratory, lower respiratory, lung infections, etc. Again, in the lung infection, you can see the pneumonia, acute bronchitis, etc. For the pneumonia, again you can go very specific, that is bacterial pneumonia, and click on the bacterial pneumonia, and you will find a code that is CA40.0. This is the ICD-11 code for the bacterial pneumonia. This portal will also run the online training module in a different self-learning modules. If you are interested, you can go for these self-learning modules also. Thank you for watching this video. Kindly like, comment and subscribe to the channel. Thank you.